Hi, I'm Nicole Clement, a Senior Program Specialist with the National Rural Health Resource Center. Thank you for joining me for this introduction to the Rural Hospital Stabilization Program. The National Rural Health Resource Center is the nation's leading technical assistance and knowledge center focused on rural health, directly supporting rural hospitals, clinics, and community health centers, state offices of rural health, and other rural health organizations with information, tools, and resources designed to help sustain access to quality health services in rural communities and improve the health of residents living there. The center's work strengthens state and local capacity in 5 key areas and is the technical assistance provider of the Rural Hospital Stabilization Program. This is our stabilization team: Karin Lund, Lead Program Specialist; Mike Rowland, Lead Program Specialist; myself, Nicole Clement, Senior Program Specialist; Tabitha Stone, Program Specialist; and Daisha Capers, Program Coordinator. This presentation provides an overview of the program purpose and services, the participation expectations, and the eligibility application and selection process. The Health Resources and Services Administration, Department of Health and Human Services, provided financial support for the Rural Hospital Stabilization Program. The Rural Hospital Stabilization Program aims to improve healthcare in rural areas by keeping healthcare services available locally. The program provides in-depth technical assistance to selected hospitals to help leaders improve financial position and increase operational efficiencies, grow current services and add new ones, to increase patient volume and improve revenue, and engage the community to support the hospital and promote hospital services to increase utilization of local services. This program aims to increase service volume and revenue to improve financial stability in rural hospitals that are mid to high financial risk, experience low or diminishing patient volumes, and have limited access to resources. The center applies a comprehensive technical assistance approach to system development that enhances stability. The center's internal subject matter experts, along with our network of nationally known rural hospital technical experts, provide a wide range of services such as financial analysis, operational assessments, education, marketing, and community engagement that financially stabilize rural hospitals with limited access to resources. Our network of hospital experts include Forvis Mazars, Eide Bailey, Stroudwater Associates, and Stratus Health. NORC and Dr. Eric Scorsoni support our evaluation process. The center's TA approach builds the hospital's viability. The program meets the clinical needs of rural communities by stabilizing rural hospitals through improving financial and operational performance, expanding existing services and adding new service lines, providing support for initial operating and equipment costs for new service lines, and engaging the community and marketing of locally available healthcare services. Services begin with the financial and operational assessment and action planning session. The FOA is foundational to performance improvement and focuses on expanding existing and new services. A feasibility and needs assessment support operational decision-making for adding new services. Leaders receive direct assistance operationalizing services, supporting equipment, marketing services, and engaging the community. The center's staff will guide hospitals through this entire process. The purpose of the FOA specifically is to assess hospital-wide operations at the department level. The FOA determines causes for financial distress, evaluates gaps in clinical services, and recommends operational growth opportunities based on industry-accepted best practices. Services include a bench analysis data request, interviews with key leaders, and full-day on-site report-out and action planning session where the hospital team establishes planning priorities to grow services and identify a potential new service line opportunity. This list summarizes the FOA scope of services. As you can see, the FOA is comprehensive, so I will give you a couple of moments to look it over. A A high-level feasibility is performed to evaluate the community's capacity to support a new service and determine reasonableness of offering the service. The feasibility provide leaders with operational decision-making information to evaluate whether they should move forward with a needs assessment. Once the leaders make a go decision, then the needs assessment can be initiated. In some cases, a hospital may focus on growing a currently existing service. In these situations, services may include a feasibility or other analysis to support decision-making, such as a service line profitability analysis. The needs assessment includes on-site clinical observations and virtual interviews with key hospital personnel to identify gaps between available and needed resources such as staffing, equipment, supplies, facility requirements, and telehealth capacity. The needs assessment includes a virtual action planning session to build out steps to operationalize the new service and support the justification of equipment needs. After the needs assessment, action planning is developed, then regularly scheduled implementation coaching with Stratus Health will occur. Implementation coaching calls assist leaders with operationalizing new services. Guidance is given on developing policies and procedures, addressing staffing and clinical workflows as examples. After a hospital completes the FOA, feasibility and needs assessment, and has started implementing services, the center helps the hospital to evaluate appropriate equipment based on identified needs and evidence-based care. Services could include vendor demonstration, purchasing steps, and other needed support to ensure equipment choices align with the hospital service line goals. The program obligates funding for initial operations and equipment costs for service line development. The program assists leaders with promoting services and provides staff education. The program also supports hospitals with approximately a 0.5 FTE to support a community engagement champion to market hospital services to the local community for approximately a year. Community engagement is essential to the hospital's financial viability because it builds broad public awareness of available services for the purpose of increasing patient volume and growing revenue. Virtual staff training and peer-to-peer education provided through the Hospital Learning Collaborative builds internal capacity that enhances sustainability of post-project performance gains. This Gantt chart illustrates how each service builds internal capacity to enhance the hospital's stability. It also provides a glimpse of how these services are positioned through the program to support hospitals in sustaining performance gains. The chart represents an average time for a hospital moving through the program. Month 1 will start March 2025. Because of the significant amount of funding obligated to selected hospitals for on-site technical assistance, strong leadership is required to ensure that the hospital benefits from program services and produces measurable outcomes. That is why it is essential that the board of directors support executive leadership and management teams in all program areas. Executive leadership and management teams are expected to be engaged in all facets of the program, and the CEO must commit the necessary time for the executive and management teams to be actively involved in activities. The CEO is expected to lead the hospital through the program. However, a contact person may be designated to coordinate communications and keep activities on track. Both the board chair and CEO of selected hospitals are required to sign the Memorandum of Understanding, or MOU, to participate in the program. To be eligible to apply to the stabilization program, hospitals must first meet HRSA's definition of rural. Hospitals designated as critical access, prospective payment facilities, rural emergency and tribal hospitals located in a rural area are eligible to apply. You can learn more about eligibility on our website. Applications are accepted on a rolling basis, and a new cohort of hospitals begins each program year. The application process consists of an easy online application that gathers contact and baseline information about the hospital and how the leader envisions the program assisting their organization. The application requires the candidate's acknowledgments of the program expectations And if selected to participate in the program, the requirement for the board of directors and executive leadership to sign an MOU to work closely with the center and our consultant network to achieve the program's purpose and goals. The online application aims to screen and identify applicants that fit the program technical assistance model and could benefit from services. Identified applicants may be asked to provide additional information such as governance, key financial indicators, utilization of hospital services, and patient volume following the web application to further support decision-making. Based on the additional information gathered, the hospital CEO of these identified applicants are invited for a review call to complete the application process. The call gathers more details on the hospital's financial status and patient volumes. This application review call provides leaders an opportunity to learn more about the program through one-to-one conversation. Leaders gain a greater understanding of the program purpose, benefits, services, and expectations of participation. More importantly, it allows leaders to make an informed decision to whether the program is a good fit for their hospitals as well. Submission of an application does not guarantee that the hospital will be selected for the program. Up to 8 hospitals per cohort will be selected for on-site technical assistance services that improve performance, grow currently existing services, and add new service lines to expand access to local care. Applications are evaluated based on several considerations that define how well each applicant hospital's needs coincide with the program's purpose and goals, and the commitment of the organization's leadership to participate fully in the program. Additional considerations include, but are not limited to, the board of directors' support for the executive and management team's involvement to maximize the opportunity for the hospital, organizational readiness to undertake a large project, ensuring that other current hospital projects would not inhibit the team's engagement, alignment between the hospital needs with program services. This includes, for example, the type of services currently provided and opportunities for service expansion, and trends that indicate the hospitals may be at mid to high financial risk and experiencing decreasing patient volumes. Lastly, participation in other similar federal and state programs. Applicants must not currently participate in another federal or state program that provides similar services. This ensures services are not duplicated and limited resources are maximized for as many rural hospitals as possible. State partners may be asked for their input because the level of engagement in state programs can predict the hospital's involvement in new programs. Applicants not selected to participate in the current program cycle are considered for future cycles. Up to 15 hospitals that are not selected for on-site TA will be invited to participate in a learning collaborative, which will help them to be more competitive for next year. For hospitals interested in participating, we encourage you to apply early, considering the timelines shown on this slide. Applications for this first year were due January 15th, and hospitals will be notified of their inclusion into the program in early March with a kickoff webinar on March 18th for the 8 selected hospitals. Christy Edwards is our Rural Hospital Stabilization Program Coordinator at the Federal Office of Rural Health Policy and can be reached at the email listed here. If you have additional questions, check out the frequently asked questions on the Rural Hospital Stabilization Program website. Additionally, you can contact us at the stabilization email address on this slide. Thank you for taking the time to view this information.